Welcome to Module 7 of the Cancer Toolkit. Please ensure that you've completed all the previous modules before starting this one. In this module, we're going to aim to increase the awareness of prostate cancer, learn and understand the key messages to share with others, to discuss which websites to use to find reliable cancer information, and also to increase confidence in talking about prostate cancer. So, what is prostate cancer? As you might imagine, prostate cancer is cancer of the prostate gland. Cancer is when abnormal cells start to divide and grow in an uncontrolled way. The cells can grow into surrounding tissues or organs and may spread to other areas of the body. And most prostate cancers start in the outer gland cells of the prostate. They are called ancilla adrenocarcinomas. Many of these cancers grow extremely slowly and are not likely to spread. So what is the prostate? Well, the prostate's a gland, usually the size and shape of a walnut, and it grows bigger as you get older. And it's located below the bladder and surrounds the urethra. The main job is to help make semen, the fluid that carries sperm, and that's why the prostate's situated where it is. So who has a prostate? Well, men, trans women, non-binary people who were assigned male at birth, some intersex people. If we just break that down a little, a trans woman is someone who was assigned male at birth but identifies as a woman. Trans women can develop prostate problems even if they have taken hormones. The prostate is not removed during genital reconstructive surgery. A non-binary person may not identify as a man or a woman, and an intersex person may have both male and female sexual characteristics and so might have a prostate. So a few stats about prostate cancer. It's now the most commonly diagnosed cancer in the UK, although this ebbs and flows sometimes between breast cancer and prostate cancer. They are kind of very nearly level pegging, but it's certainly one of the two most commonly diagnosed cancers. And they estimate that 1 in 8 men and people with a prostate will get prostate cancer in their lifetime. And for black men, that's 1 in 4 black men will get prostate cancer at some point in their lives. Black men are far more likely, or twice as likely, to get prostate cancer than other men. And it's one of these cancers that mainly affects people as they get older. So it mainly affects people sort of coming up to the age of 50 and beyond. So in the UK, more than 55,100 men and people with a prostate are diagnosed with prostate cancer every year. And if it's diagnosed at stage 1, it's almost a 100% survival rate for 5+ years. So we go back to that line, if you like, about early detection saves lives, that key point. It's really important for people to get in and see the doctor early. And how it might get diagnosed. First and foremost, a doctor or GP would like to do a PSA test. This is a prostate-specific antigen blood test. And what it can show is it can show elevated blood markers in the blood that will suggest that we're starting to develop issues with the prostate. A doctor may also want to carry out a digital rectal examination, which is an examination of prostate through the wall of the rectum. A very easy way for a doctor to feel if a prostate is enlarged or to feel if a prostate is hardening is to just do that, to feel it. And the easiest way to do that is for them to put a finger up somebody's rectum so they can feel that. This test's actually being reduced now. So they're relying more on the PSA test because even with a thorough examination, a digital examination, they still can't get around, if you like, the blind side of the prostate. So there could be issues there. So they sometimes do a combination of them both. They may also send someone for an MRI scan, or if they do find issues with it, they may carry out a prostate biopsy, which involves using thin needles to take a small piece of tissue from the prostate. The same as any biopsy anyway. Any biopsy just involves taking a tissue sample and having a look what that tissue sample can tell them. They may use a CT scan, a bone scan, or indeed a PET scan as well. And if we're treating prostate cancer, if there is a diagnosis, there are several different treatments that they can carry out. And they may sometimes have a combination of these. They may use surgery, depending on the size of the cancer or whether or not it's spread. They may use radiotherapy. Or the doctor might suggest just monitoring the cancer instead of treating it straight away. Sometimes People may have prostate cancer for 15, 20 years, and in the end, it's something else that kills them. It's not the prostate cancer. So it can be a very slow, not always, but a very slow developing cancer. So in Leeds, about 43% of prostate cancers are diagnosed at stage 3 and 4. That's around 4,100 new cancer diagnoses every year in Leeds annually. And the 5-year survival rate for prostate cancer is approximately 80%. But this depends on things like diagnosis and treatment options and how well somebody engages with those. Now, some of the signs and symptoms that we're looking for that are common, things like trouble weeing and emptying the bladder. So someone may go to the toilet, they may feel like they're bursting to go, and then when they've got there, there's a weak flow. And they may have finished or thought they've finished, and then they put themselves away, and then just as they're leaving the bathroom, they have another little wee. Sometimes they just wee more often. This is often at night as well because of how the kidneys work when we're laid horizontal. So someone might find themselves getting up 2, 3, 4 times a night to go to the toilet. And when they get there, it might be a weak flow. It can also be a sudden need to wee. So a few minutes ago, you weren't even thinking about having a wee. Now you feel like, I really need to go really quite quickly. And these can be caused by other things. These don't always mean that this is cancer. They can be caused by non-cancerous illnesses. But let's find out what's going on. If things have changed for you, then let's find out why they've changed. But often people don't experience any symptoms. So risk factors are, if you're aged 45 and over, then you are starting to increase your risk. If you're black, for the reasons we mentioned earlier, that twice as many black men and people with a prostate develop prostate cancer. If your father or brother's had prostate cancer, and there's also some research to suggest that if your mother or sister's had breast cancer, you might be at a slightly increased risk of developing prostate cancer. Now, there's a little link at the bottom of this slide, so please take note of that, because that link will take you to a risk checker that you can use to see if what risk you're running really. So as we said before, when you get tested, there's no national screening service. They've recently just had a vote and decided not to put a national screening service in place. And I won't get into the reasons for that here. But what your doctor will do, what your GP will do is the prostate-specific antigen test that we spoke about earlier. And any raised levels there may suggest there's an issue. And then they may carry out the rectal examination, and both of those would take place at the GP surgery. And if you were concerned about the rectal examination, then they will offer you a chaperone if you wish to have somebody else in the room. For further information about prostate cancer, then there's Prostate Cancer UK, which are a fantastic charity that work nationally to raise awareness and also provide advice. Macmillan, as always, as well as Cancer Research UK and the NHS, and also Leeds Health Awareness, which we try and keep our website up to date with as much valid information as possible. This now concludes Module 7 of the Cancer Toolkit. Please can you complete the assessment before moving on to the next module? Thank you.